It's your big break.
Okay, our meeting is now live streaming.
Thank you. Good morning. The time is 9:04 a.m. The date is June 6, 2024, and this is the regular meeting for the Joint Labor Management Benefits Committee. Can I please have a roll call, please? Do we have roll call? It doesn't say that.
Yep.
Lovely.
Roll call.
Thank you.
And we're going to go in the order of the agenda. So when I announce your name, please confirm your attendance. Dana Brown,
Present.
Tony Royster,
Here.
Matt Crawford sitting in for Matt Rudnick.
Here.
Hetty Santos sitting in for Holly Walcott.
Here.
Janita Igualier,
Here.
Marlene Fonseca.
Yeah.
Esteban Lazardo,
Here.
Lisa Palombi.
Here.
It's a quorum.
Thank you so much. Item number 2, public comments. Do we have any public comments?
For those who are participating telephonically, if you could press *9 on your phone to put yourself in the speaker queue. For anyone who's in the room, please bring your speaker card to the front. Not seeing anybody in the room coming forward and not seeing anybody in the queue.
Thank you very much. Moving on to action items. Item number 3, the minutes. There is a recommendation to approve the minutes of the February 1st, 2024 regular meeting. Are there any changes to the minutes, or I'll entertain a motion? Thank you. Moved by Tony. Thank you. Second by Lisa. Can we have a roll call?
Sure, we're going to go in that same order of the agenda. So Dana, your vote.
Aye.
Dana votes aye. Tony, your vote.
Aye.
Tony votes aye. Matt, your vote.
Aye.
Matt votes aye. Petty, your vote.
Aye.
Petty votes aye. Janita, your vote.
Aye.
Janita votes aye. Marlene, your vote.
Aye.
Marlene votes aye. Esteban, your vote.
I think I'm supposed to abstain because I was looking at the minutes and apparently I didn't make this meeting, so I apologize.
Oh, that's fine. Lisa votes aye. It's still a quorum of ayes and the motion passes.
Thank you. Moving on to item number 4, Committee Report 2423, staffing reimbursements for third quarter of fiscal year 23-24. I think we have a staff report.
Morning, this is Ted Vasquez, Benefits Analyst, Employee Benefits Division. Committee Report 2423 requests that the committee approve staffing reimbursements from the Employee Benefits Trust Fund for personnel department salary costs of the 4 positions serving the LA Well program and the 2 positions serving the Live Well program for the third quarter of fiscal year 2023-2024. Attachment A of the report provides the calculations of these costs, and the LA Well program's total reimbursement amount for the third quarter is $144,930.21, and the Live Well program's total reimbursement amount is $78,279.52. And that concludes this report.
Thank you. Do we have any discussion and or questions on this report? Okay, I do think that this is an action item. I will entertain a motion.
Move approval.
Thank you. I'm moved by Esteban, second by Matt. Can we get a roll call, please?
We're going to go in the same order. So Dana, your vote.
Aye.
Dana votes aye. Tony, your vote.
Aye.
Tony votes aye. Matt, your vote.
Aye.
Matt votes aye. Petty, your vote. Petty votes aye. Janita, your vote.
Aye.
Janita votes aye. Marlene, your vote.
Aye.
Marlene votes aye. Esteban, your vote.
Yes.
Esteban votes aye. And Lisa, your vote.
Aye.
Lisa votes aye. It's unanimous. The motion passes.
Thank you very much. Moving us to item number 5, which is a very heavy report. Committee Report 2424, which is about the 2025 LA Well plan adoption. There is a report on this from staff, and then we'll have to take action on these items. And I'm sure there'll be a discussion. And so we expect this to be the heaviest part of the agenda. Is that so?
Probably between this one and the next one.
Lovely. Thank you so much. So I will pass the torch over to staff. Thank you.
I'll start with order. And because it is a lot of information, we do want to kind of go through it efficiently. This is the second part to everything we discussed on adopting the plan for 2025. When we discussed medical renewal last meeting, there was a request to bring Anthem forward. So we're going to bring both Anthem and Kaiser forward to speak. We're going to go through this though in a little bit of order and try to be efficient. Chung's going to start us off and go through section A. Then we'll have Keenan come in and give an update on medical plans. Then we'll go to Kaiser and then Anthem. And then Chung will return to section B, and then I'll finish it off for C and D. And we're asking all the speakers to be short and concise and keep their presentations to single digit numbers. Go ahead.
Good morning, JLMBC members. This is Chung, and I will be going over section A and B with you today. First up on page 1 and 2, we are recommending that the JLMBC take action on 4 items. The first is a recommendation for the approval of the 2025 LAWell program benefit service provider changes. These include rate increases, decreases, or no change to the rates for 2025. These also include benefit provider changes. As you are aware, we had released an RFP for the life, disability, AD&E benefits, as well as the flexible spending account benefits earlier this year. Through the RFP process, we had recommended that MetLife and Ameriflex be selected as the recommended service providers for these RFPs. Over on page 2 is the second recommendation to approve the proposed program changes for 2025. Now, these program design changes are primarily related to the life, disability, and AD&D benefits. They include changes to the basic life, available supplemental life, and the dependent life coverage amounts, as well as the removal of the age reduction component, an increase to the basic disability coverage amount, a revision to the benefit waiting period, and an increase to the healthcare flexible spending account for 2025. The third item is to receive and note information regarding the projected expenditure changes for 2025. And the fourth item is to request that the Personnel Department transmit a report from the JLMBC to City Council for recommending the adoption of the 2025 LAWell program. Please note that the Los Angeles Administrative Code provides that the City Council authorize suitable employee benefits program as recommended by the JLMBC and maintained by the Personnel Department. This report is being brought forth to the JLMBC each year and outlines the changes to the LAWell program, including the renewal rates for the upcoming benefit year. Now, on page 3 is a summary of the benefit service providers and renewal rates that is being recommended for adoption by the JLMBC. And then before we move on to page 4, Kina will be doing a presentation for everyone here.
Good morning, everybody. Megan Gardner with Keenan, and I'm joined by Borden Darn from Keenan as well. It's good to see you all again. We're here to provide an update on the medical renewals, as well as just a couple other updates for some other programs. We have gone through the process, as we mentioned last time. We were really in the thick of the renewal discussions with both carriers. Since that time, we have had ongoing discussions and meetings with the carriers. We have had all of our questions answered. We've gone through several different analyses. Can't ever get that word right. Analyses, I guess. Where we landed is Kaiser is coming in at a 5.06% increase, and we are still at rate cap with Anthem, 11.9, I believe, for the 2020 contribute funding towards. Wellness programs are hard because to definitively and 100% say that they are the reason for better utilization is hard. ROI is hard, but they definitely have an influence and an impact, and especially over time. So the initiatives that your wellness program undertake can and will have a positive impact on utilization from the perspective of behavior change and how folks utilize the program, as well as education, right? So how folks utilize the program and how they shop and consume their healthcare makes a big difference. Going to an ER versus using an urgent care, obviously those costs are very different. So there's a lot of components. All of those things together, they're little grains of sand that make a beach, right? And help you kind of have that better utilization experience. So they are important. And that is something I don't want to speak for the city, but I know that is something that they are actively working on and continue to do so with that wellness program. Great questions. And wellness is not just limited to your medical plan. There are wellness components as part of the other benefits. And moving into kind of dental and vision, both of which are in a rate guarantee period, they are also active participants as part of wellness and contribute to those initiatives as well. But those two plans are in the middle of a rate guarantee period, so their rates will not change for 2025. So dental and vision are locked. Your EAP program does have a CPI or index in their contract, so the rate will be increasing from $1.56 PEPM up from $1.52 PEPM for the 2025 contract year. And then, of course, Chung touched on the life and disability RFP for 2025. And so we do see some differences in costs relative to program changes. Plan designs do impact the costs that are out there. So we have some recommended plan design changes that we overall are estimating will come in at a 0.3%-ish, kind of a flat program cost. So you're getting those program enhancements at the same time, you're keeping your cost relatively flat. And we'll talk about those in more detail. And then also the AmeriFlex contract. We have been in the post-award negotiation process with AmeriFlex, and at this point consider them successful. They have come back with a more competitive financial position, resulting in a 17% decrease from current. So that is good news on that front as well. And with that, Chung, do you want me to go ahead and turn it over to the program?
Yes.
Okay.
Next up will be a presentation from Kaiser and Anthem.
Yeah. Thank you.
Good morning. I'm Michelle Dubois. I'm the Senior Executive Account Manager that oversees the City of Los Angeles for Kaiser Permanente. Virtually, we also have Director for Strategic Accounts, Public Sector South, Justin Cow, Underwriting Manager, Bob Gonzalez, and our Senior Underwriting Consultant, Mark Chopik, will also be joining me for our brief presentation. So Kaiser Permanente is not like any other traditional health plan. We're different because we're an integrated care system. In our model, primary care, specialty care, and pharmacy, labs, medical facilities, and healthcare coverage are all linked together. So the health plan, medical facilities, and physicians work together to coordinate a member's care. Because of our integrated model, our cost structure is largely fixed, similar to a hospital. So Kaiser Permanente has been working hard to provide competitive, sustainable, as well as predictable rate actions. Our 2025 rate actions show our commitment to return to more predictable rate increases. I would like to introduce Mark Chopik, who is our Senior Underwriting Consultant, to provide a high-level overview for this City of Los Angeles 2025 renewal.
Perfect. Thank you, Michelle, and good morning, JLMBC members. So looking at a high-level overview of claimant activity since the rating of the 2024 renewal, we have seen a 6.9% increase in total claims dollars, going from 190 million to just about 203.5 million. The average membership over the 12 months periods has increased 1.7%, as it went from 34,740 members to 35,340. With that membership increase, our per member per month claims activity saw an increase of 5.7%. For comparison, the Kaiser Permanente Southern California Health Plan on a per member per month basis saw an increase of 3.7%. Large claimant activity did see a significant increase compared to last year. Last year, there were 4 claims over the pooling point of 850,000, equaling to just about $500,000 over pooling. And then this year, we have 5 claimants over the pooling point of 900,000, equaling to about $2.8 million in pooled claims. These pooled claims do get applied as a credit and helps decrease the impact of overall claims increases in your rating. Looking at the major service categories, inpatient, outpatient, and pharmacy, on a per member per month basis, inpatient utilization increased 11.3%. This is in comparison to the health plan at 2.9%. Outpatient increased 2.9%, which is in line with the 2.7% that we saw within the health plan. And then in pharmacy, we saw an 11% increase, which is about 1.1% better than what we saw within the health plan at a 12.1%. So I know that this is a very high level overview of the utilization. If there are any questions, we're happy to answer what we can. And if we don't have the information available with us right now, more than happy to follow up with the desired information. Thank you.
Are there any questions for Kaiser Permanente? Thank you for having us today.
Thank you.
Next up, we have Anthem.
Good morning. My name is Kristen Nelms. I'm an account manager director for our strategic accounts department. And with me, I have Nicole Harbour, who is the account management executive that works closely with the city of Los Angeles. First, I'd like to thank you all for the opportunity to address our renewal and any questions that you have with Anthem's renewal. We've enjoyed working with the city of LA for the past 8 years, and we understand that your objectives are to find long-term stability within your premiums, to ensure access and foster innovation within your members. For the 2025 plan year, as noted, we have provided the city with 11.9% rate cap. As you mentioned, this was part of an RFP a few years ago where that was included. That 11.9% rate cap, as you can see, has provided financial stability to the city and to your members. Back in 2017, when Anthem partnered with the city, we did it for the long term. And we started with a commitment to provide the city with a choice of 3 HMO networks and a PPO plan to offer your members choice outside of Kaiser. We also added an on-site concierge to assist your members with any service inquiries they may have. And we included a generous wellness budget to assist with wellness initiatives such as on-site cooking classes, fitness classes, and additional funds to support the city where they think it's most appropriate. We also at that time understood that mental health was a huge priority for the city. So we included one of our behavioral health resource buy-up programs to provide additional resources and benefits to your members. Together with the city, we have improved our programs based on your information, your input, your recommendations, and our findings within your own utilization. So through that, over the past few years, we've added a Vivity patient navigator. That person works very closely with Vivity members for what we call inter-Vivity referrals, which means that if you're, say, for instance, your PCP is with Cedars and you want to have a specialist with, say, UCLA or Huntington Hospital, that patient navigator could assist with those Vivity referrals outside of your assigned medical group, rather. We also, a few years ago, noticed an uptick in PPO utilization. So we partnered with a company outside of Anthem called Consumer Medical at the time. Now they are referred to as Alight. And it's essentially a second medical program, second opinion medical program. So if members are going through acute care and need help and direction, that program is designed to support them, to give them really clinical guidance. And we've seen quite significant improvement in your utilization for the PPO. So we're proud of the work that we've done there. And we've also, as we've discussed at these JLMBC meetings, pharmacy has been a big topic, the cost of pharmaceuticals. You have one member in particular who has a long-term pharmaceutical that, as we shared with you previously, isn't provided by any other manufacturer. So the cost, the ability to control that medication is challenging. A few years ago, we included the pharmacy cost within your medical pooling point. So what that means is when we look at your overall utilization, we take a look at the medical and the pharmacy, and we provide a cap of right now it's $300,000. So any amount over that $300,000 is a liability essentially for Anthem Blue Cross and not for the city. So another way to add further protection for the city. And through it all, I think it's really important to add that Vivity continues to be a very competitive offering for your members. When we introduced it in 2017, it was a really attractive plan design for your members because they were looking for access to really UCLA and Cedars at an affordable price point. So it came in under the Kaiser renewal. We're proud to say that it continues to be under the Kaiser renewal rates. So even going into 2025, those Vivity rates are 10% lower than Kaiser. I'd like to share with you sort of, I think the question is really, and Tony, you asked the question, sort of what will the renewals look like going on the forward? Let me just share with you sort of our historical performance for the city, because I think that's important to recognize. So since we wrote your account in 2017, the average increase has been 6.52%. Some years we're under a rate cap, other years we're not under a rate cap. So in years where we did have a rate cap in place, the average increase has been 8.27%. In years where there's no cap in place, the average increase was 4.77%. The reason for that being some of those years were deflated utilization because of COVID. I think at the end of the day, what I want to share with you is you really have our commitment, and we're focused on three areas: controlling costs, whether that be looking at different programs like the Vivity Patient Navigator, the Second Medical for PPO plan, and really our hospital negotiations and medical group negotiations. Anthem is best in class provider discounts. That's really important to control costs. The other is ensuring access through a diversified option of plan options. So whether that be our full HMO network, our select HMO network, Vivity network, or PPO, your members have a broad access of choice of providers. And really at the end of the day, what we're most proudful of is making sure that your members are served. You know, having access to our on-site concierge that works exclusively for the city is a really integral part of our team to make sure that your members get the support that they need. As Keenan mentioned, we are looking forward to responding to the RFI. So we will be submitting our response to that. I believe it's due on June 14th. And we're looking at your experience now. Your plans are experience rated. So we look at your full experience for the prior 12 months, and we sort of project that forward to see what that renewal looks like. At this point, your experience is improving. We're optimistic on how the plan is running. There was a comment just made a moment ago about pricing being in a deficit. We start with a clean slate. We don't look at any sort of deficit. So I want to assure you that next year we'll look at the prior 12 months of data and project forward. So hopefully that gives you the confidence of really our commitment through 2017, the different supports that we're providing along the way. You know, we continue to evolve and grow with you, and we're really proud to be a partner with the city. So with that, I'll open it to any questions.
I'll just make a comment. I mean, for me, my members, they read these. They watch these things. They reach out pretty often and hoping that Vivity doesn't go away. My members are the ones really utilizing it to stay and grow and invest. Great.
Any other comments or questions? Okay, thank you very much. Appreciate it.
Thank you.
Is it possible to ask our folks? I forgot to ask a question on this one when they were up. Can I?
Sure. I want to bring Keenan, right?
Keenan, yeah.
Megan, anybody reporting, looking back?
Sorry about that. And while you're coming up, you had mentioned this before. So we've got rate cap this year, but we won't have rate cap next year. That's just contractually done.
Right.
And so I think I know the answer to this question, but what is the possible increase that we could see next year without a rate cap? And I know that's hard, but
Right.
she just gave me averages over time.
Yeah.
It sounds like it could be at least 6 points.
Right. So the concern is this, where Anthem did just mention that they start with a clean slate.
Yeah.
So it will be underwritten off of a brand new 12 months because we're a year later. Okay. However, if projections were hit correctly this year, we would need to see about an 8% decrease in claim costs
Right.
to wipe out the difference between the cap and where the underwriting showed. And that's the concern. And we will work very diligently with Anthem relative to that. But my concern is that we're starting at 8%.
Right. No, so I mean, so foreseeably, we're looking at a very strong potential increase without a rate cap. Not in this one, but in the subsequent one. And if we enter into this contract, it includes the outgoing years.
Well, and there's a little bit of a complicating factor in that this is the last year of the contract.
Right.
So the question then becomes, is it an RFP? Is it a renewal? What does that look like? And that's really what the ad hoc subcommittee
Okay.
is kind of working towards deciding.
Okay, so we do have options then. Okay, well, that's good to know. That's really what I'm trying to figure out. I appreciate it.
Yeah. And in addition to that, there's nothing more than the city, Keenan and Anthem want that 8% to get squished as much as possible. So
That's 8%. That's an 8% increase in claims.
so we will be looking.
I'm sorry to interrupt, but when I translate that, I know that we talk about it in numbers, but that literally means people who may have a claim trying to not have them have claims. No, I agree, which is why I like
it's
the fact that we're talking about
right.
an entirely different thing these days than we were 20 years ago. But that still concerns me. In order for us to get that, it means that maybe people who have things, and I'm not saying we would discourage anybody, but it's a rub for me.
Well, I think that's where the programs that Kristen
Exactly,
mentioned,
right.
managing conditions.
Yes.
So that claims don't spike.
No,
or
I know.
More
Yeah.
costly.
No,
are
I'm-
very
yeah.
important.
And I get that, because I'm not trying to say that we're discouraging anybody, because I agree with your point. And that's why I refer back to 20 years ago when we didn't even have, wellness care. It was just, you get sick, you go see the doctor, if you go see the doctor, you think you're not going to be covered. So I do appreciate that we're trying lots of things. Okay.
And I think I should clarify too. When we were talking about claims, but we're talking about projected claims.
Yeah.
Projected claims have trend attached to them.
Yeah.
And so forth. And I think it's that trend factor and perhaps some other components that can impact. Is it really going to be 8% at the start?
Okay, I appreciate it. Thank you very much. Sorry.
The options that the committee here is the month of you. We could do a renewal or does it go to RFP? At that point, for either of those, you are able to negotiate rate caps down the road or?
Rate caps are always part of the discussion. Sometimes they come with caveats and those are the things we kind of try and dig into, but yes, they're always something we try to negotiate or bring into the contract.
Okay. I mean, I feel like the wellness. Maybe we should be looking at more aggressive. When we started the program, we talked about target groups, folks that are right on the line of diabetic, getting them into the program. We can't ask them who it is, but we can seek it, I don't know.
And I think the thought is that the wellness folks are going to be coming in a few meetings to kind of discuss that, right?
Yeah, and can you remember we're in the middle of transitioning between platforms. So we picked a new vendor for a wellness program, and they are coming with a bunch of options that the prior vendor was not able to provide. And one of the key things that I think is going to help, they're providing health coaches that members will be able to work with at their own discretion if they want to, and along with the other avenues. It's just getting it up and launched. And the problem though is we're not going to solve something in a month. It's going to take time to be able to try to see some progress. But there's good future potentially.
Also, is the relation of the high claims, due to the fact that there are these good high hospitals? I mean, that the folks that are really have these illnesses are gravitating to cases, so it might always be the case for those that are.
I would say, and Gordon might have a comment on this, maybe it could be, contract negotiations with hospitals happen continuously throughout the year and throughout the duration of their contract. And I know the carriers are, they are always negotiating the best deal possible to kind of control those costs for your groups. The HMOs are capitated. The PPO is a whole different model. So really the concern on the HMO side is negotiating those cap rates, getting all that kind of dialed in, which Anthem has been successful with a number of very large medical systems this year and getting new contracts and assuring that there's no disruption or lack of access for members. But through that process, they will, I'm sure there's going to be, and I won't speak for them, but I'm sure there's going to be wins and some losses just as we negotiate our contracts. So I would say maybe.
So last question, that $300,000 threshold. Is that low? Is that high? Is that?
We feel it should be a little bit higher than what it is. There's a cost associated with that threshold. And trying to find a sweet spot of the cost versus that protection is really what we want to dig into deeper. And I think that was one of the conversations that we had as part of this renewal process. And I think Anthem agrees it should be just a little higher than what it's at right now. But it does provide you with that protection on those high.
And I have just one last observation. So right now up on the screen, it shows 11.9 premium increases for Anthem. But even so, the Vivity rate is still below the Kaiser.
Correct.
So if you look at the actual rates of the plans, because right now it kind of looks like, oh, their increase is twice as much as Kaiser's increase. But when you actually look at the rates themselves, it's
Right. And there's a chart with the rates in there as well later in the presentation.
If I could just share 2 points. Even the city of LA is too small for us to determine how many large claimants you're going to have. I can't tell you how many million or even $500,000 claimants you're going to have. So from one year to another, it's kind of luck that what happens, and we have to underwrite to that. The other point that I wanted to make was a few meetings ago, we gave Keenan's report on healthcare trends and so forth. One of the big areas, inclusive of wellness, is going to be working with our carrier partners to make sure technology, AI, comes forward and is used by the members. You brought up diabetes, and I have a very specific example. Last week, I was here in LA, staying just around the corner at the DoubleTree for a meeting with another client that's downtown here. And the meeting was at 9:30. At 8:15, I noticed that the room was very bright and I was shaking. And being diabetic, I immediately recognized I'm hypoglycemic. So the beautiful thing is that I got my phone out, went to my little app to check my blood sugar level, attached it to the little sensor that I have on my arm, and it told me, yeah, your blood sugar is way down. And I went down to the hotel, got half a cup of orange juice, and it normalized. My point in that is, had I not had that technology and known how to use it, it would have been a call for an ambulance, emergency room, because of all this. And I think the more we can get this type of technology, and even this technology has been around for a while, but even the newer technology, get that out to people that need the help so that they can help monitor themselves and reduce costs on the plan that way as well too.
Is that technology that you use something you purchase on your own, or is that provided by your medical?
No, it's all through insurance. Yes.
And a lot of medical carriers do
Yeah.
provide that kind of technology. The challenge is you bring a horse, you need a horse to water, you got to get your members to drink. And that's where education comes in. Those outreach programs that the carriers are doing are so important because hopefully maybe they can get folks to use it.
Okay. Okay, going back to the report, moving on over to section B on service providers. From pages 4 through pages 9, we are providing more in-depth background information on how each benefit service provider was selected to provide the benefits for the LOL program, as well as the steps leading to the rate changes for 2025. Megan has touched upon a lot of these benefits and these benefits providers and their rate changes already, so I'm not going to go into them in detail. But did you have any questions about any of the benefit providers or proposed rate changes for 2025? No? Okay, then moving on over to page 9 for section C, plan design changes. Paul is going to be taking over at this point.
So these are going to be, we have not changed plan design for the plan other than just our annual increase in health saving accounts and disability for quite some time. So we did have our RFPs for life, disability and AD&D. And those benefits have been pretty static since 1996. And we are recommending some changes to those coverages, which are outlined in these 7 items here. So we're recommending to, out of everything available, we're recommending some gradual changes for 2025. We're saying to take the basic life insurance that we provide to all employees in LAWell to bump it up from the current $5,000 for a half-time employee and $10,000 flat for a full-time employee to be $25,000 for that half-time employee and $50,000 for the full-time employee. We're also asking or recommending to remove the age reduction factor. So in a concept, we do have a good number of employees who are age 65 or older, and their benefit currently gets reduced quite a bit under the age reduction factor. So by removing that, they'll still have that same, if we do the $50,000, the same $50,000 level all the way through the end of their employment. Those recommended changes actually are the most expensive ones that we're offering or that we're recommending in this concept, and they still don't cost the plan that much. And I'm saying most expensive from the employer side, what the city's going to pay. It about doubles what the cost is for that coverage that we're providing, but that double cost is still a very small amount in the overall budget for this program. And we'll talk about that in just a second as well. That's for life insurance for the employee. Then the other one with life insurance is we're recommending increasing the option that an employee can voluntarily pay for themselves. So increase the amount that an employee can buy for themselves, as well as removing that age reduction as well. From current up to 5 times salary, the recommendation is to go to 7 times salary, still with $1 million cap. That was what was proposed by all the bidders. And then on what they can buy for their dependents, we're recommending to increase the spouse domestic partner level from the current $1,000 cap, $100,000 cap to $250,000. And then for child life, to increase it from the $5,000 limit up to $20,000. Those are all options that the employee pays for by themselves. The city does not pay anything. And we're recommending to remove the age reduction factor on the spouse life as well. For disability insurance, we are recommending that we increase, there is 2 different versions of our disability insurance. It's the basic level that we provide to all employees, which is 50% of their salary up to a cap. And then the supplemental insurance level that employees buy at up to 66% of their salary up to a cap. We are recommending to keep that for now. as to what the bidders have proposed, but to increase the cap from the current amount up to the maximum of $5,000 a month for the basic level insurance. So the current level is $3,630. We're asking to increase it up to $5,000 as the maximum benefit. And then the bigger potential item here is to change the definition of when an employee can get benefits for those who are on workers' compensation. So we are asking to recommend changing the benefit waiting period, which is the delay in providing a benefit, to include IOD payments. So we talked about it briefly before. What happens in current day, an employee who's on workers' comp, they qualify once they pass that 6-month mark of getting disability benefits. But there is no exclusion for IOD pay, and employees in a workers' comp leave still get IOD pay usually for a year. So they are approved for a benefit while they're still getting a city paycheck, but that city paycheck offsets that benefit. So they're approved for a benefit and they get essentially the $0 from their disability benefit. That is also our approval for disability is tied to benefit protection. So they get their benefit protection to start at that time, but they still are getting city paychecks at full pay while they're on IOD. So there's nothing to protect. So by including the IOD payments into the waiting period before they can get a benefit, we're essentially extending the time period that they can get a benefit at an actual benefit replacement cost, because when they're not going to get a city paycheck anymore. And we're extending the benefit protection period to be able to continue their medical coverage after they go on state rate and they stop getting city pay for the full time period that they're on approved for disability. It's complicated. But it is a big benefit or a big enhancement to our employees who are on a workers' comp leave and successfully file for disability. And then for accidental death and dismemberment insurance, we are recommending to revise the application of dependents to that insurance. So right now, if somebody purchases a family plan and they include their spouse and their child, and somebody has an accident claim that they need to proceed, it is proportioned by the type of accident, but then proportioned further by the type of dependent. So your dependent spouse only gets 20% of the overall package that you purchased. And then that 20% is even lowered by the type of accident or injury you had. So the employees have a hard time understanding that because it's really confusing. So we're recommending to remove that dependency. So the individual that's covered in the plan could have up to the full amount based off of whatever their injury is. And then that one also has an age reduction component. We're asking to remove that as well. And then the last one is increasing our annual healthcare flexible spending account limit up to the current federal limits to allow employees to contribute as much as they can. That was a lot. There is a lot of detail in the pages too that we can go through. I'm happy to answer, me and Chung are happy to answer questions that you have on any of these changes. But these would be, if the committee adopts any of them, would be effective starting January 1st. Yes.
So for the, I was following because I had this situation where that did pay out of the IOD and response. The only thing I wanted to ask you is that would that be an increase for the employee who elects to have additional disability insurance, or is that a cost to the city?
It would technically be a cost to the city. So the employee wouldn't experience any difference in their benefit that they're getting, just the timing of when they get that benefit. But the city would be essentially continuing to pay things more, specifically on the plan, the wellness, the LA Well plan would be continuing to pay medical benefits and other benefits longer because this employee would qualify for a longer period of the current.
Do you have an idea of what that, like, if that were affects you?
I tried to quantify it. It's too hard because it's too volatile on how many people qualify for workers' comp. And that's all, it's too difficult to understand. But we think it would be very similar, essentially cost neutral, because it's also in the same line of fluctuation and volatility with enrollment that we can't control, what we see on a regular basis.
I just wanted to just kind of formally say how much I appreciate this proposal and how your staff has gone to the trouble of, you know, taking into consideration what you see in practice when employees have a need. As HR professionals, you know, Petty and I certainly see when things go really badly, it's terrible when we have limitations on coverage. I mean, you know, just personally as a city employee, you know, insuring my children for $5,000 seemed disrespectful, if I'm being honest, but that was all there was. So I do appreciate, you know, the time and effort put into this and how you use the information that you have about what happens when employees have a need and the barriers that they come up with. So I see a lot of that baked into this proposal. And personally, I absolutely appreciate the money that the city, anything that the city can afford to do to help employees who are in this situation, which is a small number of employees who actually need to access, you know, these benefits. Again, in personnel, you see, you know, you get up close and personal when employees die on the job and what happens with their families and what they are entitled to and not entitled to. And so, again, I just wanted to say for the record how much I appreciate the effort placed into this proposal and the compassion that you guys use, professional compassion, because you see what happens when a small, you know, percentage of city employees need these benefits and their limitations. So I appreciate that.
And we went through the work comp stuff really quickly and I do understand the work comp, but it just two quick questions. Right now, do they wait till the end of the 1 year and then they gotta apply for the standard disability and there's a waiting period?
So no, technically that they don't have to wait that period. They can apply right away. Under the current process and policy, the short-term disability plan cannot allow for a worker under state law, cannot allow for a claimant to receive short-term disability. So they have to, our current process and structure is short-term is six months, and long-term is anytime after that. So they can apply right away. They can get approved right away, technically. But they won't get approved for short-term. They only get approved for long-term.
Well, this changes it to allow the approval of short-term.
No, it does not. What it does change is when they can get that benefit. So instead of them getting the benefit at that 6 months period, they're going to get the benefit after they're done with their IOD pay, whatever that is, which typically is 12 months. We see. And then that will start also their benefit protection plan.
So currently they can get their IOD payment and the standard check?
They can, but the problem is the standard check has an offset, which this one will too. When we're switching over to MetLife, they'll also have an offset. The offset, you're not going to get more in disability than you got while you're actively employed. That's how it works. And so the problem that happens right now, since IOD pay is not excluded from this concept, it is offset from their benefit. So they are approved for a benefit, and then they have their disability pay reduced by whatever they're getting from their city check. So their city check is 100%. So the disability check is as low as it possibly can go. It is not zero, but it ends up being like $200 or something. I can't remember the exact figure.
Just two other quick questions on the life insurance. Do the employees know the city disability?
They currently do, and under the new vendor, we will have continuation options as well. We're still working with those. We're still in negotiation on the contract approval.
Yeah, that was. And if they don't fill out beneficiary forms, will MetLife keep out with?
That's something that we're going to ensure. There is a state law process when there is not a beneficiary identified. And then there's then in the proposal, if I remember correctly, MetLife identified that they use LexisNexis kind of thing to search for people. But there is a process that we expect to continue that is currently used.
Yeah, because we do use them and they're really good, but we're a smaller group in the city. But I'm hoping that you can capture them.
Across both the extended new contracts, the new providers, plan and the plan design, where do you see potential kind of disruption for the users, for the employees? Are there any places that we need to be particularly conscious of as we move into 2025?
How this is being proposed, no. There doesn't, how we're still in negotiation with the new providers. Don't expect any disruption per se. There are some decisions to make on how we're going to have things represented to the employee. So the employees, so for example, if someone had $100,000 purchased for their spouse, which is the maximum, are we going to keep them at the same $100,000 and tell them, hey, you got more, or is there another option to take? That's a discussion to have with our TPA and overall, and talk about what that looks like. But the more important is, does the employee understand this change? Do they understand that they have more options and not just, you know, ignore it and think everything's status quo because it's been that way for 30 years? And that's still something we're working out of what our communication plan is and how we're going to be making sure employees fully understand what is their option.
Is the flex spending the same provider with a different name, or it's a new?
It is a brand new provider. We are changing from WageWorks to AmeriFlex for 2025.
I assume that'll be so.
We are still working out how we're going to approach it because there are some questions about how we want to handle the current year contributions and the 2025. One of the issues that we're looking at is because there is a grace period that extends over into the 2025 benefit year. So we're still working out, who's going to handle what and how it's going to be handled.
But those ones aren't required by federal law as being, those employees have to elect again anyway. So that one's sometimes an easier gradation, at least when that's like.
On some of the items, supplemental, is there going to be an increase in the cost for the employee?
For the disability and life insurance options, those are under the rate scales that we have. I'm going to make sure I say this correctly. Are voluntary increases. So it would be, if they keep the same level of coverage, they should see pretty much a neutral or pretty close to the same cost that they have. If that same coverage level is available to them through our negotiation, it would only be if they decide to purchase more insurance.
So about eliminating the age reduction component, that's not going to bring the low.
No, it actually, it should hopefully keep it the same. So what happens with age reduction, unfortunately, our current structure is still and it's going to still be a term life insurance, and that has tiered rates based on age. So unfortunately with age reduction, what happens is once you reach a certain age, your premium goes up, but your benefit goes down. So they're going to see no rate change at kind of to the same level as before. The cost will stay practically the same if they keep the same level, to just the increased benefit option that they hopefully will never have to use.
But they will have to explain to their children why they're still at $5,000, correct?
Well,
Yeah.
That's
Yeah. You can insure me for 25, Mom, and you did 5? Yeah.
Any other questions? So I think we're at so the rest of the report was just the budget piece, which is we already talked about, is essentially cost neutral. And the overall adoption. So this does go to council. By whatever the community decides to adopt today, whether it's the recommendations or something different, it is our start for programming the system for open enrollment. So it does kick off a lot of work.
So would it be appropriate to move approval of report 2424?
Yes, so if that is the recommendation, now, if somebody has a different recommendation, I'm just saying that you need to be clear about, what you want to take out and or change or otherwise. But if not, then Esteban moved that we accept the recommendations in total for report 2424. Okay, Tony is second.
Okay, then we will go ahead and do a roll call vote. We'll run the same order of the agenda. So Dana, your vote.
Aye.
Dana votes aye. Tony, your vote.
Aye.
Tony votes aye. Matt, your vote.
Aye.
Matt votes aye. Petty, your vote.
Aye.
Petty votes aye. Janita, your vote.
Aye.
Janita votes aye. Marlene, your vote.
Aye.
Marlene votes aye. Esteban, your vote.
Yes.
Esteban votes aye. And Lisa, your vote.
Aye.
Lisa votes aye. It's unanimous. The motion passes.
Thank you so much, colleagues. That was easy. That was great. Thank you guys for that report. There was a lot in it, and we appreciate the time you took. Moving on to item number 6, committee report 2425, which is an HRP update and possible LA well plan rule moratorium. I will allow staff to jump into that.
So this is not an easy conversation to have, but we're gonna try to make it as easy as possible with what is going on and where we're at. So when we talked with the committee before, there has been a concern on us getting our data file correct in passing data backwards and forwards between the city and the vendor. We have made a lot of progress, but we have not gotten a completely accurate file feed at this moment in time. We're still working, HRP team has been working with us. We're still making changes. We do not know what it's going to look like at go live though. So right now we have the file outbound from the city to TELUS, the vendor, still has some inaccuracies, I'll say, in giving hire and termination and job change information correctly. It has some inaccuracies in sending hours of employees, which are vital for correct processing of valuable benefits. And it has some other quirks to it, but those are big enough components that are going to cause a lot of trouble potentially for us at go live if we cannot solve them before then. What we are planning to do with TELUS is to work with a kind of a contingency model where we're going to load the file that is received into a test environment first, kind of analyze it before any action is taken on any employee. What that means is manual labor for staff to try to vet whether or not the information is correct. And what that also means is a delay in us processing items. So a new employee that comes over is not going to get their new hire offer regularly because we are no longer able to process things in a couple days. Yeah, I don't know what the timeline's going to look like, but we will not be able to say that you can elect your benefits right when you first get their first paycheck. It's going to be a period of delay. The other issue or concern in this process is our physical ability to be able to manage just regular functions. So in this committee, we had shown a demo of how employees do their time entry. And I think everybody saw all the citywide emails and everything of all the people that didn't do it correctly. And I think that's the area of concern. In our
with how do we deal with the data transfer? If the data transfer is poor, can we just suspend the rules for that pay period, which we have done in the past in part, during COVID. I know we did it for part-time employees who had benefits. We suspended the rules and allowed them to collect their benefits even if they did not meet the threshold. So we've done it before. And so that the recommendation that he's making regarding data transfer is that suspend the rules and everybody gets their benefits regardless of how many hours they worked, right? So that's one part of what he's saying. The second part is the emergency check part, which he's saying the people who get emergency checks are not paying their benefits. So if there are a certain number and he had a threshold, then let's just do a premium holiday, meaning nobody has to pay. But they think that it's fair for the entire city not to pay, not just the people who, the 600, 800, however many people didn't pay their premium because they had an emergency check. As an aside, I want to say for emergency checks, there are emergency checks every single pay period, just so you know. We've been having a lot of conversations with various council committees about, go live and emergency checks. And, it's a scary concept. And it's like, oh my God, but every single pay period, there are emergency checks. And so and there are going to be some emergency checks on first go live. Just like there's going to be this pay period and we're in Pacer. So we don't know exactly what to expect. But I do think, based on kind of the direction that we are giving to departments, that we may be able to know, Paul, before the paycheck, how many emergency checks there are going to be. I do believe if everybody does what we've asked them to do, right, which is to enter early, payroll sections are, everybody go in themselves, everybody enter early, payroll sections can now determine, where there is a problem, and we will know if there are going to be emergency checks. Well, there are going to be some, right? Because there's some every time. Doesn't matter the system. Nevertheless, how many there are going to be, which speaks to Paul's, concern. If there are so many emergency checks that I can't go back to get the money from people. So that's kind of the environment that we're in. And I know there are different elements to that. And I have a couple of questions and suggestions that I'd like to at least start to sort of put out. So as it relates to emergency checks, whether there are 100, that you deal with every pay period anyway, or whether there are 600, is there not an opportunity? Like, we know it's going to take time, obviously, to determine, because this would presuppose the problem happened, right? That's why there's an emergency check. So it's going to take some time to ferret out, some of those emergency checks may not actually even owe a premium, maybe, right? So you're going to have to ferret it all out, and it's going to take time. Is there not an opportunity to go back and get the money later? And somehow we would have to say that on the front end. Like, people would have to know, like, from I don't know if, from a legal place, if, we have to tell people ahead of time, like, employees know what their responsibility is to their premium. And if their premium is not taken out of their check because the check is emergency, can we not go back once we figure out what it is and be able to do that and actually have those employees pay their premiums? Now, that's one thing. I also wanted to talk about, just so I can be sort of done, and so we're not back and forth, it's just me and you talking. Okay. I also wanted to speak to new employees. And is there an opportunity for new employees to actually come to employee benefits with whatever documentation you need? And I don't know what that is, but you tell us what it is. And from an HR place and payroll inside of the departments, we'll make sure employees have whatever you need in order to invite them to benefits. And I don't even know whether or not it's possible, but this is my thought process for those employees who need to sign up for their benefits as soon as, they're eligible. And then, I already said, as it relates to the suspension of the rules, that we've done that before. That certainly seems like a great idea to me. And how much it's gonna cost the city, I don't know, because I don't know how incorrect it may be, right? But but the threshold part for the suspension now, so now I'm talking about the suspension of rules. The threshold part seems to be tedious to me. And if we're going to suspend it, like, why don't we just suspend it? So those are kind of my comments, just kind of to start the conversation. If you want to respond to some of them, and then maybe, my colleagues can, join in.
I can definitely respond to the first two, I think. So for the first one, our ability to go back, under our contracts with providers, there is a set period of time that we can make changes. So the concern kind of in delaying, or the potential, I guess, result in delaying us billing somebody is the provider's already set in stone what that benefit looks like. So if somebody doesn't pay their bill, the city already paid for that benefit, we can't cancel it after a certain point in time. So with our medical, at least with Anthem, which is probably the one where
I
we
think
see
the question was just, is it possible to retrospectively charge the employee again?
Well, it's technically possible, but the city would still be on the hook.
I think she understands that. You
Yeah,
understand
because
that,
we're
right?
gonna pay, because that's what we do, right? We're gonna pay it anyway.
Right. The question is there a possibility of recouping some of this?
And it would be, well, just to be clear, we're only recouping part of it.
Okay.
So out of, like, say
That's
the
perfect.
premium is $1,000 and the subsidy is 700, so the employee pays 300, just throwing
Yeah,
numbers out there.
okay.
At a certain point, after we get 90 days past that, city paid that $1,000, there's no changing. So the ability for the city to recoup funds for that $300 is all that's available. And whether and then if the employee just says, no, I'm not gonna pay it, then what do we do?
Right, but your proposal is that we don't get any of it back. We just pay the $1,000 and everybody has a free ride.
That is one part. Yes,
Right.
that is one
Okay.
part.
Right.
Once you get the threshold, so if we're under the threshold, or am I mixing my apples?
No, that is correct. So the original proposal is we, in our current process, is supposed to audit every single record. We think we can handle an increase up to a certain amount.
Right.
So as long as it's not exceeding that threshold, then everything stays the same as it is. That is one option to
Because
go.
there's always emergency checks.
There's always,
Say that.
How many emergency checks in them?
that's a great question. I'm not sure.
But what's your threshold? No. Well, no, one, two, and division.
400.
So
What's your threshold?
So it would be, it is the 700 that is on a record. So that is an emergency check is a deduction not taken.
Right.
So that shows up on our audit report, is included with what we currently get between the 300 and 700 of pay period.
So your threshold for I can handle it is 700?
Correct. That is currently, and that's a staff of 3 people.
Yeah.
That is reviewing.
And
Now-
700
now-
is more than you normally get, but 300 is closer, correct?
Right. Yeah. Yes, that's fair.
But also keep in mind that his report also said that currently on the last time they ran, they got 10,000 errors. So there's a possibility he gets above the
Oh, no,
700.
that was
Or is that different?
controller. That was the dress rehearsal.
Okay,
The dress-
sorry.
the
But that's
dress
what I mean, yeah.
rehearsal, they
But
said
the
that-
dress rehearsal, I'm so over the dress rehearsal. I mean, I'm sorry,
That's okay. I mean, I'm not criticizing that. I'm
No,
just
no,
saying, just,
understood.
okay, trying to put the numbers in perspective. So there is a possibility we could go over 700.
Also, you could look at it aggressive, so it wasn't the full picture because you have timekeepers, like for instance, our department, that probably.
I'm not trying to say the dress.
No, I'm just.
Good or bad, just trying to give us a number, that's all.
Let me finish. All of that. Is that a number, even half our department are not included, so it's really not a real picture. Because half our payroll is done by timekeepers. Timekeepers did not have a process. So it's really not a true picture. And if that works, then we're okay. The thing it is, I think the most important thing, people get paid and people have their benefits. Because if you don't fix that, it's gonna cost you more than $1 million to pay for.
So we all know that an employee can't have their money taken away unless they sign that authorization, right? I think what Dana was asking is, can they sign that ahead of time?
And say, I'll give you your $300 back whenever,
Right.
you know.
Everything is squared away.
I mean, technically, I think so. It's,
But the problem is if they bills, like that's a lot of money to take.
No, well, it's not, well, we don't expect that. And Paul's recommendation is not for several pay periods. You know, it's like, it's the first one.
Yeah.
Correct.
It was the
well,
first two.
so
Yeah.
one by
First
one.
two.
So the recommendation so far is added, so the JLMBC is not meeting again until August 1st. So the recommendation is to have a threshold applied to the first 2 pay periods. And then we'll reassess and when the committee reconvenes.
And
on
we'll
August
have a
1st.
report on August month, so we can be looking at real.
Yeah, and hopefully it will be, yeah, everything was great.
Could be.
But it's the same time, it's the nature of what we're dealing with, it's gonna be a problem. You have to be able to be flexible. Like I said, there are 2 goals, is to make sure people get paid, and 2, they have the benefits. And if we don't do that right, whatever, you know, although the city might be paying $1 billion, you're gonna be paying more on the back end. If you wanna get it right. It's something that is the nature of what we do. At the same time, we want to take care of our employees because they provide the service. Because if you get this up with this, some of them might not come aboard. And you have a big problem.
So since we're talking about the emergency check premium part right now. I don't think it's unfair, right? That an employee who had an emergency check gets a premium holiday and the other employees don't. I don't think that's unfair because the employee with the emergency check has already suffered something, right? They didn't get their check on time. You know, they didn't get their check when they were supposed to. I mean, because if we're talking about practicality, so if it's me, you know, based on my direct deposit, I get my direct deposit on Tuesday morning. And even though payday is Wednesday, not in my head, right? Okay, so, but the controller is not gonna cut me a check on Tuesday morning, no matter what. So I am going to suffer some if I have to get an emergency check. So a premium holiday, because my check got messed up by no fault of my own, or maybe it's complete fault of my own, but maybe it's actually complete fault of my own. But if I have to get an emergency check, I feel like there is a suffrage of that employee and that it's not unfair that that employee get a premium holiday for the pay period that they got an emergency check. That's my opinion. I mean, I'd love to hear what you guys think.
So I just want to ask, Paul, what is the basis for your recommendation of the approved recommendation to go wide instead of just the ones that got the emergency check?
It's really just the perspective of fairness. If we're saying this publicly, maybe we're gonna see some employees that say, hey, I have to pay.
Okay.
But I mean, it's all.
Then I agree with Denise.
So we deal with this all the time, and I'll tell you that from the members' perspective, it's unfair. However, in the same way, we sometimes like feel that I got a step higher and somebody ends up getting that advanced step, you know, all that next step. If somebody is owed some money, they know that they owe it, right? If they happen to get lucky or if they is not paid it. I don't necessarily think that we can never do it. I got $10 on the schoolyard, all the things, right? I would turn it in. If nobody claimed it in a week, I gotta keep it. But that didn't mean they had to give everybody.
I think for me, what would actually trigger the emergency check would, for the most part, if my understanding is correct, is like somebody like doing it wrong. So it's almost, or like there, or
That could be a
potential-
way, but it could
potentially.
just be the system. The
So it could be the-
system got it wrong.
So it could be the system or it could be employee error. So it's or because one of the things that is like some people not entering it correct. So it's almost like if you took out the time to learn how to figure out how to do it. Like there's like you're gonna pay a premium as somebody that went through the training and actually did the things and did everything accurately. And for that, and I get it that this is something that I should have or would have paid anyway, but it's, for lack of a better way, rewarding somebody for not quite doing it the way they should.
The other part of that is not a free employee for some reason, is actually not. The leader is that JLM the other day when I asked, like, there's some, I was like, those building employees are not touching it, I don't know. Yeah. But
I think what I hear our staff saying is that in trying to decipher what to do with the ones with the emergency checks, which they anticipate should be, or very likely would be higher than the average number we normally get, that in that regard, it might make more sense to just make sure we don't have, as Royster says, lapse in benefits, even though there may be some unintentional benefit that people who themselves didn't do it correctly. But trying to decipher between, once you get to 700, how many of them may have done it because they screwed up themselves or somebody else, that's just too much trouble for those people at least. But I understand the extension of fairness. But so I myself don't have a problem with the premium holiday or whatever for the people who get emergency checks. I'm not necessarily convinced, but I think it makes sense. I agree that there's a fairness deal to everybody, but I'm with Ms. Fonseca. Just for those who could do emergency.
Sorry to take it back, but with an emergency check, if like I've been here, I've been working with the city forever, and my check gets messed up, you still know how much benefits to take out. So I'm not understanding why an emergency check can't already know that. Like, why are we assuming that for everybody you can't take out their benefits in an emergency check?
In the setup, it does not, deductions don't get taken. Only, but in the general setup. Now, for clarification though, I have not seen,
And that's the
I've spent a lot of time, we've done a lot into the new system and testing. We're very involved in it. I have not seen an emergency check for employees yet. I've seen one for sworn, but not for civilian. And what I did see for sworn looked like it still needed some work. So we don't really know what it's going to look like yet when it gets done. But the expectation is that the deductions will not be taken from that check.
Can I ask a technical question? Is there even a way to give everyone a premium holiday?
Yes.
Yeah.
So
Yes.
it
It's
is.
easier to do that than with their.
No,
No? Okay.
I mean, it may be easier,
because
but it's,
you got timekeepers doing this brand new for the first time. You're gonna now tell them like how would the controller just automatically wipe out that?
It would be us.
yeah.
It would be us telling the controller
That's
and doing it.
Yeah,
So
I think it is easier, but it's super expensive.
it is very expensive, and I'll just say it wouldn't happen immediately, right? So our in this launch, so for the check that's happening on July 10th, the controller is working, not me, on transferring all the deductions from the payroll system and Pacer over to Workday. We are not going to be able to see that until the end of June to see that those transferred over correctly. And then we will be only making changes moving forward. I still don't have a good process of being able to make corrections. We're still testing that. So it would be a correction that we would do to suspend a deduction for 26,000 plus employees.
So based on that timeline though, and based on the timeline that HRP, the project team has presented, do you have the ability in sometime in those 3 days, July 1, 2, 3, to make that decision?
No.
So
it would-
when I guess the actual question then is, when is your timeline to make a decision? If, and I don't think we're recommending it, but if we were to say, okay, forget it, premium holiday, we can't figure all this out, when do you need to tell the controller that? And is July 3rd too late? Because that's when you're going to know if the problem is big enough that you want to do that.
So in payroll close process, what we'd be proposing, if there was a decision by the committee to do premium holiday across the board, it would essentially be a credit for the ones that got their deductions taken on July 10th that we would do at a future time.
Oh, so you would do it like on the 24th paycheck, everybody would just get that money back?
I would not be able to commit to that timeline.
Okay, the August,
In
a
what's going
future
on.
pay.
The next two.
Okay,
At some point in the tax year, it would be a credit. That would be the only way we could handle it.
which would be a bunch of manual work for you guys anyway at a later date.
Oh, very much so. Well, just to be blunt, everything that we're seeing in Workday is going to be a lot more manual work than what we have normally done. So all our processes are going to take longer.
So I think, I mean, just trying to hear what folks have said and on the rules suspension, I totally agree with what Dana said. I don't think you need to worry about the threshold. I would propose we just tell you right now to suspend the rules through all of July and leave it at that. I don't want you guys to be trying to guess, trying to estimate how many problems there are and if that's enough. And I just assume there's going to be a bunch of problems and set that off of your work plate, because you guys are going to be super busy dealing with other stuff.
Right, and the suspension of the rules, if there are a few problems, I mean, there's always gonna be people who don't meet the rules. There's always gonna be. And I'm sure Paul's staff has stats of how many those are every.
I can give you an example if you like. I'm Isela, benefits analyst with the Employee Benefits Division, and I actually oversee the billing section. So I wrote down some numbers to give you guys an example. So the last pay period that we invoiced was pay period number 23, which ran from April 21st through May 4th. We get the report a week and a half later, and there was 338 employees on that report that we had to manually one by one cross-reference. When we were done about 5 days later, a total of 246 employees were billed. The only thing I didn't write down right now, because we haven't received all our payments, is how many people actually paid.
Yes. Yes.
I didn't, I'm sorry, I didn't, because believe it or not, I'm still getting payments for the prior pay period.
So if they don't pay, they just during that pay period did not have benefits, but you kick in the next pay period.
Eventually we do that, yeah. We send out a billing invoice, and your billing invoice has a payment due date. That's your initial invoice. If we don't receive your payment by that initial due date, we give you one more opportunity. We send out a final bill notice. Now you have another payment due date. So if your payment is not received by that second due date, that's when we go in and update records to, like you said, update benefits showing you had no coverage because you didn't pay. No, that's the same. The way the process is right now, no, it just.
You spent money on your course.
Which when we retroactively cancel, that is the city's portion gets credited, correct?
So this is could be a significant amount of money that the employee gets relieved of if a mistake is made in their paycheck.
It could be, you see people in the family PPL.
To Penny's question though, related to what? Related to the.
What are they being
pay
relieved of?
deductions, or related to, there's a rule suspension?
If there's a rule suspension and even if it sounds like we'd lean towards a rule suspension that's just for the, not for everybody, but just the people.
No, it's for everybody, right? Rule suspension would be for everybody.
I know,
Not
but
to be confused
we're actively discussing whether or not it would be just for the errors or for everybody.
I probably.
I don't think so.
Okay.
Okay, just make sure I'm clear.
Well,
The
okay,
rule
can we-
suspension.
Can we just let? Betsy
So
ask
I
the
wouldn't
question?
vote for a rule suspension for everybody personally, so my vote would be a no on that, but I probably would vote on. I'm thinking about, would I vote for relieving the person that had the mistake in their paycheck and then they don't have to pay?
Check.
And I'm just trying to get an idea for it, on that emergency check, since it doesn't include deductions, it could be a significant amount of money for that individual, right? Like $500.
Wait, okay, hold on.
And
The
we're saying they
rule
wouldn't have to
suspension,
pay
this
that.
is very complicated, so I just want to make sure we understand. You can't rule suspend for some people and not others. Rule suspend would be, in my opinion, unfair if you don't do it for everybody. Because, right, some people it's gonna work. You did not work enough hours, you do not get your benefits. You know what I mean? It's gonna work. As opposed to so the rule suspension just means everybody's gonna get their benefits no matter how many hours they work. That's what rule suspension is, right?
That is.
Okay. Emergency check is not that. Emergency check has to do with who paid the premium. And if you, and so that's the thing that I was saying. I don't think it's unfair if emergency check people only didn't pay their premium, because it just makes it easier for you certainly not to have to go back, right? So a premium suspension for those who got emergency checks is one thing. And that, you know, I'm not making a motion yet, but that I think would be fine. A suspension of the rules for everyone during those pay periods so that everybody gets their benefits regardless of the number of hours that they work is a separate thing that has to be done as well. And then the third thing has to do with new employees, which you didn't address yet, about, you know, how do you get on the benefit program during the, you know, days of using abacuses and whatever you're gonna be doing, you know, as we get into this. I love the laugh that knows what an abacus is. And then there's people like, what's an abacus? They're like, what's an abacus?
What's an abacus? Unfortunately, I do know. Okay.
It's like in the moat.
Yes.
I really get it.
So I understand the semantics of what you just went through. So, but the scenario of relieving someone who got an emergency check and they don't have to pay that back, it could be $500.
It could be. So our members that have PPO family pay a good amount of money out of their paycheck. There's members that have a life insurance amount that's quite high because it's age-based, and so it can grow depending on what they selected. So yeah, it could be hundreds of dollars in one pay period.
And then you have done this before. So you don't have an ethics, gift of public funds issue on that.
Well, the premium component, we have not done. There has been a suspension of the eligibility of hours.
Okay.
I mean, I'll say, you know, I'd love to put up here and say, yes, give everybody the benefits for those pay periods, but my concern is, the city budget, and what are they gonna take from us, like, if they're just building my deficit, then they're gonna come to labor to offset something.
So there's also a tax piece that we didn't talk about because I didn't have it in here and didn't think about it. So what we could actually consider too, because we're already modifying a recommendation, it seems like potentially, I don't know what you guys are going to decide to do. But if there is a decision to go forward with a premium holiday of some kind, we could actually pin the action of it until we meet in August. So essentially say, we're going to kind of to the points were made earlier, say, hey, we're wanting to do this premium holiday for those who have an emergency check situation. But before we actually give it, which is the city pays the difference of it, we'll collectively come through with a dollar amount on August 1st, tell you what that looks like. That could be another option.
Just because I think it would key it up, stop talking about it in theoreticals, I'm prepared to move the staff report with the amendment that it would only provide the premium suspension for those with emergency checks, not a premium holiday or not a suspension of rules. That's my motion. So it would.
Say it again.
Okay, so I would move the report, but to limit the non-payment portion of it to those who are emergency checks with a premium suspension, to allow staff to allow premium suspension for those who get an emergency checks, but not a suspension of the, what's the last word? Suspension of the rules, not a suspension of the rules overall. So it would focus it on those with emergency checks.
So point of clarification, that assumes that they don't have to pay it back for a week.
Yes. Now now my motion doesn't foreclose the fact that the committee may decide after we get the report that they would go back and do something. But for now, for purposes of trying to make sure what Mr. Royster had to say is correct, which I agree with him, I think the thing that makes the most sense is to move the staff report minus the premium holiday, and focusing on the suspension of premiums for those with emergency checks.
Does your motion include the threshold for our auditing?
Yes.
If it goes past, okay.
I'll accept staff's recommendation on the threshold.
Okay, so I think if I'm understanding correctly, it's right. We're gonna get rid of E consider enacting the premium holiday.
Well, this is his motion.
Correct.
Right.
Correct.
Yeah, no, that's my motion, right, exactly. It hasn't even been seconded.
I just
But,
wanna,
I'm just trying to get us to brass tacks, so that we can start going, yes, no, maybe.
I just want to try to put it in a visual to make sure we get it correct. And then we can change it if it does. So we take out the premium holiday part.
Right.
And
And what would we do with those people? Just
actually, your motion was only to apply the premium holiday for those of the first check, right?
Yeah, now, my apology for the semantics, but I'm trying to go with the chair's. She said premium suspension of premium. If that's translated into premium holiday for those people with emergency checks, fine. But I'm just trying to follow the actual words that were used, because I was confusing between premium suspension and suspension of the rules. So my motion is not to suspend the rules for everybody, but to apply the threshold for a premium suspension. And if that means premium holiday to you guys, for those people who are in the emergency check situation, that would be what staff would do.
Okay, so then that only deals with one issue, right? Which is fine, it only deals with the issue of premium payment. But we still need to deal with the issue of overall benefit, continuation of benefit. So.
No, I thought that's what I was doing. So if I'm not, please
No,
help me out.
that's just premium.
Okay.
That's just, did you pay your premium?
Okay.
The other piece is, do you get your benefits? Did you work enough hours in order to continue your benefits?
But that's what I understood staff saying, that we should suspend the premium rule for the people with emergency checks, because we can't tell on the check if they've done it.
No.
Make a suggestion.
Yeah, it is. Yes, it is confusing. It is. Go ahead. Elsa.
May I make a suggestion?
Sure.
Please withdraw your motion and let Paul go through each of the recommendations and let us say yay or nay on each of the A, B, C, D.
I didn't think we were gonna do it that way. Sorry. So
Oh, well, I think
I don't mind withdrawing my motion. The purpose of my motion was to get us out of the theoretical
Yeah,
and have us start discussing the actual. But I don't
Right.
mind withdrawing it. Paul, were you gonna go through A through F individually, or we're just gonna do a whole motion?
I can go through A through F individually. I think Marlene wanted to be here for the vote though.
Sure.
She'll be back in just.
Paul, as it relates to the new employees, as I see it, as I see it, that's not that doesn't have to go through this. It doesn't have to go through this committee, right?
Correct. It doesn't, but I should respond to that.
But we can talk about it later. I'm just saying, you can talk to your GM. I'll get you the time. Okay.
Because there's three different issues and they're separate. They're
Yes, they are
issues.
separate.
Although it looks like they're connected, but they're not. There's three separate decisions we have to make. Question is, we look at the holiday, why did you need that suspension? That's what we need to discuss. Once we get through that, and you go to the emergency checks, then get through that. We can't look at them all in one box.
I don't mind doing them in separates. That's fine.
there are 6 recommendations and we need to check for understanding, because I'm still hearing people say things differently each time they open their mouth. So
For the
I
record,
think
I'm
we need to
withdrawing my
check
motion.
for
and then we'll figure
understanding
out how we
each of
pin
these
this back.
ideas,
Okay.
each of these recommendations, so that we absolutely understand what you're recommending and whether or not we agree. Because I still hear confusion.
I just want to ask a question, that's a little unrelated, but it's going to help me in my decision making. There's a lot of deductions on an emergency check that it sounds like, not just the ones that we're responsible for, but there's going to be a lot of deductions. Presumably employees will be asked by other departments responsible for those deductions, maybe the unions, to pay those back. So I guess I'm making a comment, not a question, but I'm thinking as an employee who gets a lot of deductions taken out, a lot. I wouldn't expect that if I'm a employee that has 4 people on my insurance, that was going to be free because there was a mistake on my check, and everyone else is going to be asking for money back anyway.
The credit union gonna call.
Right. So I'm just kind of reconciling my head that I think it's a necessary in a way that I don't think an employee is expecting to get that free.
No, let me let you know that, like you said, there's emergency checks every pay period. And those people do show up on our billing, because they'll show up as, for example, I didn't get a paycheck, but then right above it, the way the system looks now, it's like, oh, look, a manual check. Which is also an emergency check. So we catch that. And we will send an invoice saying, hey, you know, you were off payroll or your deductions were taken. The question is, you know, how many are we gonna have once we go
And
live?
you
with
only
the-
have a certain amount of
Yeah.
time to do it. So, I mean, yeah, but that's a good point that Patty brought up. No, so the credit union is gonna be after them.
The union should
everybody
be after them.
is
Mike
gonna be-
should.
yeah,
I pay
yeah,
$158 a paycheck to my union.
Oh, Jesus.
That's
Yeah.
twice, that's
We
twice a month.
need to up our dues. Anyways, go ahead.
Yeah.
Okay, well, we can.
So can we do it in the
go
three
one
part
by one.
yeah, let's do
So
that.
we can go through it one by one. So the first two aren't actually an action to take. It's just receive and note what we talked about, what the update of has happened. The second one to receive and note that there's gonna be delays in our processes. There's gonna be delays in us offering new hires. There's gonna be delays in processing terminations. The third one, I think, from what I've heard, is going to stay as is. And so this is the first one to make an action on. To adopt a temporary suspension of LAO rules. This is just the compensated hours. So to say that whether somebody worked the qualifying hours of 40 hours in a paid period as a full-time employee or not, we're going to treat them the same as qualifying.
So they'll get the benefit and we'll figure out how the benefit gets paid separately.
Yeah, that's separate. That's separate. So item C is, I think stays as is.
C and D.
Well, just one by one.
Okay, I get you. Okay.
Can we
Just
check,
so-
can we check for understanding on C and do we have consensus on C? I think Paul is correct. I think Paul is hearing that we are in agreement with the idea
Yes.
of suspending the rules,
Right.
right?
Well,
Not
we
the
gotta
rules.
vote because
Yeah.
yeah.
I would move approval of item C and D.
You just do one.
But yes, because they're not the same.
They're not
Oh,
the
okay.
same.
Why aren't
Yeah.
they the same?
Not the same.
Oh, you're right. Temporary, you're right. Bill collection. Sorry. I would move approval of C.
Okay.
Okay, so
Oh, go ahead.
you can vote. I know that Petty had issues with it, so I guess she will,
And I
she
guess-
will speak to it.
I guess
Well,
I
she
just,
doesn't have to unless we get a second. Did somebody second me?
Oh, I'll second.
so I just have a question on C. So
Oh, can I?
now to make sure that I understand it. The temporary suspension based on the compensated hours, is there a financial cost to the city to do that?
The financial cost would be somebody who did not work the qualifying hours. You're supposed to go and get the subsidy for them to keep their benefits. Otherwise, you know, that coverage. So we would be saying that we're gonna continue paying their health care for them. The city's costs.
Yes, this is
when-
where the confusion.
So Acella's billing, she does, I wanna say it's subsidy, it was like, I don't know, around $80,000 per period or something that like subsidy people that don't get qualifying hours. So that is around the rough kind of figure of what we're cost, assuming that people still work or don't work at the same levels.
And this is the thing we've done before for half-time employees who have benefits during COVID.
And I do want to mention, the reason why I would move approval of the suspension is because of what Mr. Royce said, which is that this is the part, as I understand it, that would make sure we maintain people having eligibility for benefits. Figuring out how they get billed is a different thing, but at least if there's an occasion because of this move where somebody might fall to the cracks, this helps us close the cracks so everybody, so we suspend that eligibility for the time being, just for this one pay period.
2 papers.
Okay, 2 pay periods. So yes, I get it now.
Okay.
So that's why it makes sense to me.
So I'm
Okay.
I'm sorry to interrupt. For the record, item 6 has multiple subparts, and I know there's a lot of crosstalk. So at least for the record, if we can go as suggested by the member,
We are.
one by one,
We're all in.
item by. I understand. I'm just iterating for the record. If we just go one, I'm not questioning whether you're not or you're not, whether you are or you're not. I'm just asking, just for the record, if we can go one by one. Okay.
Sorry, does that mean that you take an action on item A?
Yeah, because this is a
Well,
receive and note.
okay,
Receiving and noting is an action.
Okay, I'll get to A and B later. I moved and it's been seconded to adopt, to accept C. That's what's up.
You got your first and second.
Okay, are we ready to then, okay, we'll go ahead and do that. This is for item C as written. We'll do the roll call votes in the same order. So Dana, your vote.
Aye.
Dana with aye. Tony, your vote.
Aye.
Tony votes aye. Matt, your vote.
Aye.
Matt votes aye. Teddy, your vote.
Aye.
Teddy votes aye. Janita, your vote.
Aye.
Janita votes aye. Marlene, your vote. Marlene votes aye. Esteban, your vote.
Yes.
Esteban votes aye. And Lisa, your vote.
Aye.
Lisa votes aye. It's unanimous. Item C passes. Which one would you want to go to next?
May I move on A and B?
Sure.
I move that we
Second.
receive, accept and receive and note the items A and B.
There was a second on that, so I jumped in before me, but either way.
And that doesn't keep you from talking to your GM about new employees, correct?
Yes.
Yes.
And you think.
Okay.
So I am going to do it in the same order. Dana.
Aye.
Dana votes aye. Your vote.
Aye.
Dana votes aye. Matt, your vote.
Aye.
Matt votes aye. Teddy, your vote.
Aye.
Teddy votes aye. Dana, your vote.
Aye.
Dana votes aye. Marlene, your vote.
Aye.
Marlene votes aye. Esteban, your vote.
Yes.
Esteban votes aye. And Lisa votes.
Aye.
Lisa votes aye. A and D pass. So moving on to D. D is adopt a temporary suspension of bill collection should the number of required bills exceed a specific threshold. So those thresholds are, we talked about them verbally, didn't show them to you. So the thresholds written here are 400 people get emergency check. So that's 400 added to our regular billing process. Or 1,000, our overall audit report exceeds 1,000 records. Those are the thresholds that we identified for either of those pay periods. And what we're saying there is essentially the premium holiday component for those individuals, which would be, we're just not going to go.
And as I understand it, this is somewhat of cost benefit analysis, how much trouble it takes to do that, given the higher number. So I would move approval of D.
I will, I think there is amending component before you say that.
Okay.
So I think what we'll want to do, because there is a tax issue to look at, which we would modify this to say, pending.
Okay.
So a temporary suspension of bill selection, if they do that, pending further confirmation, maybe, and at the August meeting, pending further review of tax compliance.
I would expect that.
So is your proposal with that language basically saying you'll come back to us in August and tell us what happened, and then we'll have a little more information, we'll make an actual decision on this?
Yes, we're explicitly saying that in it, but yeah, that is included in that. Right.
But my understanding is that the August thing is mostly related to tax complications that may do it, as opposed to it's still too much work.
Well, I think it's more, I think the tax issue we haven't talked about is, the city normally subsidizes a certain number.
Well,
So,
then-
and
then-
that
then-
is reported on employees.
Okay. Well, then I would change the deal, adopt a recommendation that staff look at temporary suspension, come back to us on August 1st. Because if we're saying it, if we're moving, adopt a temporary suspension, that's literally saying do it. So, and I'm not trying to be technical, but in answer to your question, based upon the motion, we wouldn't be changing that on August 1st because we already decided it today. So if you want to say we'll approve it on August 1st, great, but then it can't say adopt a temporary suspension. Sure, well, this,
I'll go for it because I understand what you said and I agree. It's weird to say adopt a policy pending a report that we'll get next month. So instead of adopting the policy now, I think we instruct staff to come back to us in August with the actual experience from those two pay periods and recommendations to the committee on whether and how to implement a suspension of bill collection based on the thresholds that you presented today.
and I would second his motion in that regard.
And August won't be too late for that, for bill collection?
So we will delay.
I guess the additional to that point is for us to right now instruct you to not actually send any bills for those two pay periods until you come back to us in August and we talk about it. And so, yes, that would be a delay.
Sending the invoices is not gonna be an issue. We can send them in August. I mean, now we would have to consider, Paul, if we don't get payment, we just let it slide or not.
Well, but
It's just with the threshold.
Up to the threshold, yeah.
Right.
Yeah, sending the invoices in August, it's, I mean, it's not gonna be an issue, but again, depending on the threshold that,
Well, but,
It might be an issue.
here, this would not, so if it turns out that we have less than 300 or whatever, or maybe have an extra 100, then this thing will not come into play. That's my understanding, correct, Paul?
I think we'll find out in August.
Yes, exactly.
Whether it's an issue.
Right, so I don't think delaying staff sending out a bill for the potential of the thing is an issue.
Well, I think if I'm hearing right with this conversation, what we're really saying now is the threshold is still technically, we're gonna look at it, but we're
Yes.
not gonna act on anything.
Yeah.
So we're going
I
to
agree.
essentially suspend action of doing bills. The immediate one for these pay periods and return to the JLMC with our findings and possible recommendation for actually suspending bill collection.
That sounds great. Yeah.
And the second agrees with that.
Okay, so. Okay, then if we're ready, then we'll go ahead and take a vote on the amended item D. Dana, your vote?
Aye.
Dana votes aye. Tony, your vote?
Aye.
Tony votes aye. Matt, your vote?
Aye.
Matt votes aye. Hetty, your vote?
No.
Hetty votes nay. Janita, your vote?
Aye.
Janita votes aye. Marlene, your vote? Marlene votes aye. Esteban, your vote?
Yes.
Esteban votes aye. And Lisa, your vote?
Aye.
Lisa votes aye. It is still a quorum of ayes, so the motion passes.
The next,
So if I'm hearing correctly from the committee, I think the action is to strike item E. Consider a premium holiday for everyone.
If that needs to be a motion, I would move that.
Does it?
Because if we don't take action on it, we
I
don't
mean,
do
we
it.
don't, right.
You're not.
If we're not gonna do it, we don't have to.
But it's harder than to figure out consensus.
It's part of the recommendation, though, so we have to take action.
want to continue this discussion.
No, we don't want to continue. Look, I'm just gonna make the motion, even though it may be superfluous. No, look, but I'm just gonna tee it up and you guys say yes or no if I get a second. I would move to strike item E from the report. I don't know if there's a second. And the only reason why I do it is it makes it clear what we're doing. They can always bring it back if they want to.
And even if you don't bring it back, we can bring it up because we're
Yeah.
gonna talk about it next time,
Yes,
right?
absolutely.
Yeah,
Just-
okay.
Just for the time being, strike item E.
Okay, so then a vote to strike item E from the,
Current report.
yes. Dana, your vote?
Aye.
Dana votes aye. Tony, your vote? Aye. Tony votes aye. Matt, your vote?
Aye.
Matt votes aye. Hetty, your vote?
Aye.
Hetty votes aye. Janita, your vote?
Aye.
Janita votes aye. Marlene, your vote? Marlene votes aye. Esteban, your vote?
Yes.
Esteban's aye. And Lisa, your vote?
Aye.
Lisa votes aye. It's unanimous. The motion passes. So the last recommendation on this report is for us to report back with our status of what that we talked about. But we're gonna modify this by striking the premium holiday part because that just got struck.
Well, but
Well-
if it comes back, staff will bring it back, but if we can't have them report back on something, we just told them not to do.
I think maybe just the words actual application since we're
Oh.
not.
Oh,
applying it.
that's a
So-
good
so
idea.
maybe we just strike the and report back on the premium holiday without
Perfect.
the words actual application.
So yeah, move item F with the, without.
Wait, I have a question though. How can we talk about a premium holiday in August for something that already happened?
Well, in that premium holiday concept, we didn't go into a lot of detail, I think, in how it functionally worked, but it would still be a credit, or in one way or another. But in this concept, I think what the committee is, that would be for everyone. Talking about it for
No,
everyone.
correct.
In this concept, we're just talking about it for those who had an emergency check. We're saying in what we just adopted in D, that we're not gonna take immediate action to build them. We're gonna discuss that in August. So in August, we'll discuss whether or not to send out that bill.
No, I understand, but it's, okay, never mind.
And so that would be.
It's fine. It's fine. Yeah, I don't have to understand. I mean, meaning I understand, but it's fine. Let's move on. We can vote.
Any other, oh, yes. the modification to F is just take out actual application of, at the last line. So, report back, to the committee at August 1st about the temporary suspension of LA Rail rules, which was item C, and any premium holiday. that we consider.
That was Esteban.
That was
and-
my motion
and-
Oh, okay, then, then we're ready to vote. So same order, Dana, your vote.
Aye.
Dana votes aye, Tony, your vote.
Aye.
Tony votes aye, Matt, your vote.
Aye.
Matt votes aye, Petty, your vote.
Aye.
Petty votes aye, Janita, your vote.
Aye.
Janita votes aye, Marlene, your vote.
Aye.
Marlene votes aye. Esteban, your vote.
Yes.
Esteban votes aye, and Lisa, your vote.
Aye.
Lisa votes aye, it's unanimous, the motion passes. That was it.
I am exhausted. Okay, thank you so much for that. Informational items, item number 7, committee report 24-26 on projects and activities update.
My apology, but I gotta, sorry about that.
I will be presenting this report for the JLMBC. This is the projects and activities report. So we've touched upon quite a few of these items, so I'm just going to quickly go through this. So we have an update on we have an informational update on page 1. This is regarding a Kaiser data breach that occurred in October of last year. So notes here. So last October, Kaiser found that certain online technologies may have transmitted certain personal information to third-party technology vendors when using the Kaiser website and or mobile application. The impact information included IP address, name, search terms, but did not include other such detailed information as SSN and credit card or financial account information. Kaiser has conducted an investigation into this and have removed the affected online technologies from their website and mobile applications. Based upon a recent report, it is estimated that for the city, about 24,000 members were affected. Kaiser will be sending out a notice to affected members that will include an overview of the issue, and that notice will include contact information should members have any questions or concern. Next item is on page 2 is an update on the HIPAA compliance officer position. We are happy to report that the position was recently approved by the Budget, Finance, and Innovation Committee and was subsequently referred over to and approved by the City Council. Moving on over to projects updates. First up is for the 2025 OE planning. We are going to be doing a formal kickoff meeting with TELUS this today. The kickoff meeting will focus on planning for the open enrollment that will occur this October and will include discussing timeline, changes, responsibility, and as well as developing the communication plans for all the benefit changes that will be occurring for the 2025 benefit year. Skipping on over to page 3 is an update on the ad hoc medical plan subcommittee. Megan from Keenan had touched upon this earlier. But essentially, the subcommittee has been working with EBD staff and Keenan to develop a medical plan RFI. This RFI is asking qualified medical providers to respond to a number of different questions about possible plan design options for a future benefit year. The intent is for the RFI to gather more information to assist the subcommittee in determining the medical plan options for the 2026 benefit year. The RFI responses are going to be due June 14th. And that brings us to the end of this report. I'm happy to answer any questions that you may have and also to take any items for the calendar.
Do we have any? Okay, thank you so much.
You're welcome.
Okay, thanks everybody for your patience. We finally reached our concluding items. Do we have any requests for future agenda items?
I was wondering if we could have staff request a opinion from the Ethics Commission on the ability for the city to provide an individual's insurance premium. And that not being a gift.
Okay, you got that, Paul?
Sort of, I think enough. I'll follow up with you later, but I got the gist.
We have similar situations where we have to ask for people money back on their paychecks and things, and we've always used that as a reason why we can't do it. So love to know if that's legal, that we can do it. Maybe if the city council does as a blanket, it's allowed, I guess.
Okay. And then also, moving on to number 9, our next regular meeting date, July 4th is our next meeting, but it is canceled because it's a city holiday. So, excuse me, so our next, regular meeting is August 1st, in person, followed by September 5th is also a holiday, which falls on our regular meeting date. So then we won't be meeting until October 3rd. So we have a meeting August 1st and October 3rd. Okay. All right, so the time is 11:11 a.m. and this meeting is adjourned. Thank you so much. But helpful.